just about 4 years out from diagnosis. I would like to say that breast cancer was not on my radar. My mother didn't have breast cancer. My grandmothers didn't have breast cancer. So I thought that I would be safe from that.
I was 42 years old when I was diagnosed with breast cancer in January 2013.
I was 56 years old when I was diagnosed and went to the doctor for a routine physical. Had my physical, had my breast exam, everything looked good. Walked across the street to the hospital, had my mammogram, and they stopped it halfway through. They seen it, and I did too. My cancer started out, they thought it was stage 1. It turned out to be stage 3. At first they did not think that the lymph nodes were affected, but there were some that were affected. And my cancer is invasive ductal carcinoma.
I always had yearly mammograms. I always had a yearly physical. Was not so good at breast self-examination. I occasionally would do that, but I actually did find this lump after showering and drying off.
My dad has 7 sisters, and they have a history of breast cancer and ovarian cancer and uterine cancer, but I was the BRCA gene, I was negative for that, so it's probably not the genetic breast cancer, but I do have a history in my family. So.
There were 7 girls in my family, and the youngest sister has passed from her breast cancer and was the only one of 7 that ever did a self-breast exam. I have not missed one since. I do mine monthly.
Dr. McHale was my oncologist. My husband's a physician, and he worked with him. And Dr. McHale comes to Huron, and so we were very happy not to have to travel to Sioux Falls. So we did chemo here in Huron. I had 4 series of chemo, but mine was a HERS2 breast cancer. And so you have a year's worth of Herceptin. And so I had chemo from mid-December to mid-February.
We started out with treatment with the chemotherapy, had 6 chemotherapy treatments, and from there we went to surgery. And they did surgery in February, and 10 days later they did surgery again. They found with the first surgery that there was cancer in 2 of the lymph nodes. So they did surgery the second time and took more lymph nodes and found it in 2 more. So they do think mine was contained to the lymph nodes in the breast.
The whole team, they made a plan, whatever my treatment plan was going to be, and we decided that in the best interest of everything, like the history, and the BRCA gene test wasn't back yet, we decided that a double mastectomy would be the route that I would go. Because I didn't want to, being 42, I didn't want to, just maybe do a little bit and then all of a sudden I've got to do some more surgery or I get cancer again. And, it's a very small percentage now, so that was lessening my percentages even more by doing that. So I did chemo from April until August, and then I did radiation from beginning of September till the mid part of November.
I have learned what? I have learned that you better be patient. I have learned that you need to count on others. I have learned you're not indispensable. I was always worried about missing work. Someone can do your job and it gets done well. I have amazing friends. I've learned not to feel sorry for myself. I've met so many people along the way that are struggling in worse ways than I ever dreamed of. And to rely on God.
Still have a yearly mammogram. I think that's, I just am amazed when they say that we shouldn't be doing mammograms, there's too many false positives. Well, false positive, so what, think it probably saves more lives than it does a little bit of inconvenience for a false positive. So I have a couple of friends who haven't had mammograms in 4 or 5 years, and I just encourage them to go and have a mammogram. It might be a little uncomfortable for a little bit of time, but it's such a good feeling when you get a good report. It's got to override that.
Well, I've learned a lot of things. I mean, it's just, I've learned a lot of things, about myself. I've learned a lot of things about people around you, how kind people can be, and people you don't even know who have the same experience. But now I'm on that side, and I'm the one going to people and saying, or if they said they had cancer, oh, I'm a cancer survivor too. So knowing now on that side of it, how people feel and they just come up to you. But, and how hard it is to be a caregiver, because I had more than one caregiver. My husband was the primary, caregiver, and they go through a lot. And at this point, it was the height of tax season, which is our business, and boom, my husband is out wandering around helping me, and so also, the caregivers like my parents and his parents and my kids. My perspective on life has changed a lot. I've made a career change because I just, I thought there's, more important things. I'd been doing that job for quite some time, and I wanted to spend more time with my family, and I just knew that over 10 months of doing treatment and other therapy that I needed to do something different so that I could relax.
I had no idea anything would be wrong. It was pretty shocking when it was. The main piece of advice I would give to somebody is when you first go in, they assign you a patient advocate, which I did not use right away. And that patient advocate is your lifeline between you and your doctors, and take well advantage of the person assigned to you, because they can get you answers in a very quick manner.
I asked about a cure. He said, no, you're in remission.
I didn't think I was crazy superstitious, but I'm a little superstitious. And it happened in 2013, so I didn't like the number 13 for a long time. And then I realized, you know what? It's not 2013 that I had cancer. It's 2013 that God saved me from dying. And it's 2013 that the reason why I'm still here.